difficult, but you have to do it. There are other diseases that are involved here that you can help to correct and also make the patient feel much better as well. It's about making the patient feel good and quality of life. So if we take 10,000 steps a day, then what happens is that these walking mechanics are very important in bringing blood back to the heart for venous return, as well as, each step you take, if the bones are abnormally positioned, then you're going to have wear and tear and release of inflammatory chemicals into your body that will aid you not only from a biomechanical or a musculoskeletal standpoint, but also from a systemic standpoint. I don't know if you ever caught the lecture that was given by Dr. Anton. That was a real eye-opening lecture for me. When Dr. Anton was reading a lecture that was actually developed by a UCLA professor, he was not able to make it to the Bali conference, but when I heard that lecture, it went boom, the light went on. And I said, inflammation, autoimmune, attacking the brain, the atherosclerosis, this and that. I said, that's really amazing stuff. Study and testing the interleukins and looking at your patient's level of inflammation and how to reduce that is very important. And if you don't reduce these levels of inflammation in your patient, first of all, run a test on these patients to determine their level of inflammation when they walk in the door. Find out what's going on and have a plan of attack, whether you're a periodontist, orthopedic doctor, or if you're a GP or whatever you do in your practice. You have a plan to find out what 5 different sources or 4 different sources of inflammation that patient can have, like maybe they have periodontal disease, they got a trick knee, their feet hurt, their back hurts, whatever it is that may be tripping that inflammation. But according to the American Heart Association, I pulled it right off their website, and the Center of Disease and Control and Prevention recently published a joint scientific statement about